is. So by definition, carpal tunnel is a location or an anatomical structure in here, right? So here's the ligament or the retinaculum that goes over the top of the wrist, right?
Okay.
So imagine like a piece of tape that goes over here. If I move it this way, you can kind of see.
Oh,
Look at
that's a
that.
trip.
It's a really cool. Here's a tunnel, just like the Lincoln Tunnel. A bunch of wires and cars go through there. If there's too many cars, it gets clogged up, right? And in this case, we have plenty of structures, like our ligaments, like our nerves that run through this carpal tunnel, right?
That is a trip. I did not.
So
even
check
know
this
that.
out. So this is actually by definition the carpal tunnel. We have all these ligaments, all this nerve that runs through here, and when this tunnel gets too tight, all the stuff that runs through it starts to get squeezed.
Okay.
The thing that's the most pain sensitive, or I guess you can say pain intolerant, is that nerve right there called the median nerve. So the median nerve, if you had carpal tunnel, when I was doing,
It would have hurt.
you would have felt zink, 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 because I'm pretty
But
much
how
taking...
come I feel it when I, like, sometimes I'll accidentally hit, like, up here and I'll get, like, a tingle, which is really weird.
So that's a good question. So it could be the development or potential start of a carpal tunnel,
okay.
or this is what I'm thinking. I think, and I tested your neck. A lot of times, I would say 90% of the time, and I'm throwing out a number out there, but it may not be hard. But 90% of the time that I see somebody with carpal tunnel, it's usually something from the neck or something through the arm or elbow or through the shoulder.
Okay.
I tested you multiple times. I pushed on your neck. I tried to literally close down the nerve holes in your neck, and I tried to irritate them. Congratulations, that didn't cause
well,
numbness
that's
or
good.
tingling into your arm. The
Okay.
fact that you're having it on both sides bilaterally can suggest one of two things. One, it could be the neck coming from the back, and it's like, either bulging or herniation into, one side or the other side, or it's irritating both sides, which is definitely possible.
Okay.
However, given your history with everything that you talked about, I was pulling your arm up like this. Doing something like this typically relieves pain in the neck, surprisingly.
Oh, that's interesting.
Yeah.
Okay.
So what the heck is it then? So what it could be then is what we call thoracic outlet syndrome, which is pretty much where somebody gets really tight through this area and these nerve bundles right through here. Get, let's just say here's this triangle. They get kind of closed off, or they kind of do this. I also think that there's another factor at play, which is kind of your history with the chemo, the radiation, mineral issues. I think that if you kind of get onto some sort of either supplemental or dietary change, where you just pump yourself with a ton of plant-based stuff.
That's what we're doing.
Well, that's what we're doing right now, this reset. We're doing the, what do you call it?
We're doing the ultimate reset, which is
For
takes out.
Beachbody.
In
Got it.
short, it takes out all the meats, grains, all the bullshit that you eat.
Yeah.
Takes you into being more of a vegan.
Today's
diet.
day 5, so.
Congrats.
And I've
Yeah.
done it. I've done it before.
Yeah.
And
really,
and
We
here-
needed it. Our livers needed it.
I'll tell you. I'll tell you also what I do when I don't like taking supplementation is I will break open the capsule literally, because sometimes
that's
and
a
I'll
good
put it in my
idea.
supplements.
Oh.
I'll put it in my
I
blender.
didn't even think about, but
Yeah.
the problem is the pill I was taking was just a hard,
Hardened.
solid.
Yeah, I do the ones where they're of course encapsulated.
Oh, that's
they have
a
a more of that
good
pill, like the grainy
Okay.
type sand-like. So you do spend a little bit more money, but it creates a little bit of that versatility.
Okay, I didn't even think
Unless, and I don't know how well these things digest in the blender, but because I've never tried it. But unless you want to take one of those Costco pills, throw it in there and
just see, yeah.
see what happens.
They probably just spin around in there. I don't even know if it would wind up.
But this is an option for you.
Okay.
To,
I mean,
to
I
do
can
it.
take it. It's just, it's more the smell of it too. It's just.
I know that, and it kind of feels like it's stuck here.
Yeah, I know. Sometimes I'm like.
But this is a great way for you to still take the pill without even knowing that it's in there.
Okay.
And you just chug the
Okay.
whole thing on smoothie.
Well, and plus we do 310. I don't know if you've heard of 310 nutrition. Oh my God, they're like the best shakes. They're plant based. They're
That's
really
awesome.
good. So we do that too.
So when I put
So I
your
can throw it in there.
arm like this, I wish this thing moved, but what can happen is that you put your arm like this and it provides slack in the nerves here. When I pulled on your arm and I kind of like tensioned out, it kind of stretches the nerves through the armpit in this area, and that's when it increased your symptoms. So if you had to tell me or if I had to tell you exactly like in a nutshell, what is happening, I think you're probably getting a nerve root or a nerve cord irritation through the thoracic outlet.
That's what's causing like the tingling.
That is associated with the history that you've had.
Yeah.
I don't think we can say yes, this is one thing. I think, and I've just done this for 10 years, and just having unfortunately enough chemo and radiation patients come through the door, whether it's for pain relief or just post of this, there's just never like a conversation where I don't have this conversation. I always like to cover every single darn base that I can,
well, that's good.
whether it's chiropractic, whether it's soft tissue, whether it's nutritional. Like if I didn't, in my opinion, if I didn't mention nutritional supplementation, I wouldn't be doing my job. And I don't even sell nutrition here. I don't even sell any supplements here at all. Okay. So I would highly recommend that.
And where do you go? Like GNC, or do you go to like Costco?
I have like I'll tell you some other stuff. I have a couple of websites that I typically recommend.
Maybe you can email it, just because I'm never going to remember all this.
Yeah, you just tell me what you need from me, and I'll help you out.
All right, cool.
There's definitely things, but I do think that if we work a little bit through the neck, through the shoulder blade, and kind of open up the pec a little bit, that might provide a little bit of relief. I don't think you're going to get a quote 100% relief. You may not even feel much relief from the treatment itself. Okay. But I do think that when you irritate, I do know when you irritate maybe one of the cords or the nerves up here from either chemo or from other issues or from the brachial issue, which, and I said brachial, I mean this area, you can have more of that irritation going further down, which is what you're having. Just higher likelihood on the right side than you are on the left. I do think that maybe from grasping a little bit more, you might have a little bit more of that irritation here. This is where we're talking about the median nerve.
Because I was just doing a lot with my hands, obviously with cleaning, and I'm right-handed and picking up all those goddamn boxes, and I mean,
these boxes.
It's a pain.
To
move.
So I think in your case, you have a few different factors, and I don't know which one is. To be honest, I don't know which one's going to iron it out the fastest. But if we take a multifactorial approach to a multifactorial kind of symptom, then we have better options. You guys are already like hitting the nail really hard in the head with like the nutrition planning and like the detox and the
we're
resets.
Going to continue eating this way. I mean, we eat pretty okay, but we do, we'll cheat. We'll be like, fuck it, I don't want to cook tonight. We're going to go get a burger.
You're allowed to. You're allowed to live your life. But
we gotta.
But I would say like even if like you can. That's why they call them supplements. They're a supplement to your life. Yeah. They shouldn't be a replacement for a burger or vice versa. Okay. A burger shouldn't be a replacement for a supplement.
Yeah, it could be.
So I would say that banging on this carpal tunnel is not an issue for you, but I do think maybe some of that nerve irritation may be causing carpal tunnel-like syndrome.
Should I still wear that? I mean, the thing goes up and over my thumb, and it's pretty solid. It's good. I went to an orthopedic place. And,
do you find relief with it?
I mean, it kind of seems like it. I don't wake up as much with the tingling fingers, so I don't know if it's. I don't know.
Here's what I say: if it's helping you, I don't care. Just make it work. Okay. I don't want you to rely on that forever. But if it's helping you in the short term, irritate this thing less, so that later on in the day when you lift a box or cut something or using scissors and then it's not flaring up, high five, congratulations. We are reducing irritation and inflammation totally through your body. And now you have a nerve or an area of the nerve that is less inflamed and less likely to be irritated further. We know what it's like to have a paper cut, and then we go squeeze lemon juice. We're like, shit, this hurts. And then we go ahead and we scab pick and we open it up. How is that thing supposed to heal if we keep irritating it? Okay. It's not, or it's not going to do it very quickly. Okay. So in your case, I definitely think it's more of just like the whole thing that's going on. I do want to work a little bit through the chest and open you up though. So we'll do some of that. Maybe
try and crack my neck for sure.
We'll adjust your neck.
And the other weird thing, this last thing, it's so strange. My ribs have been hurting me lately, and it's what in the hell?
We haven't